You might be your kid's best drug dealer, shockingly. According to a report by the Partnership for Drug-Free Kids, 53% of teens who misuse prescriptions got them from a friend or family member. I'm Jodie Sweetin, and today on Awkward Conversations, we will discuss the critical importance of keeping your home prescription safe, educating yourself and your kids on the dangers of prescription drugs when misused, and how to properly dispose of them. As usual, I am joined by Amy McCarthy from Boston Children's Hospital. Hi, Amy.
Hi, thanks, Jodie. Today we have another great episode with some great guests. And the first up is Luis Agostini, Public Information Officer for the DEA's Chicago Field Division. Hi, Luis. How are you?
Hey.
Hey, Amy, Jodie, how are you?
Good.
Also joining us today is Dr. Heather DiBlasi, an award-winning educator who speaks to thousands of kids and families every year about drug education and prevention. Hi, Dr. Heather.
Hi, how are you?
Great. We're doing really well. Thank you so much for joining us today. I know, these days so many of us have prescription medications in our house that we want to keep safe and prevent from being misused and abused. What are some of the ways that we can make sure and keep prescriptions safe in our house so that they aren't misused by other people?
So I would say, one, ensuring that those medications are out of the reach of anyone who it's not intended for, especially children and youth, keeping it out of reach. Also, I think the most effective device is that cap lock, right? Making sure that the cap on those bottles, whether they're vitamins or supplements or prescribed opioids, making sure they're twisted and locked all the way so as to deter misuse or accidental use from a child or anyone else in that household.
Got it. And what happens, as kids get a little bit older and, now they can figure out the safety locks, they can figure out how to open the child-proof containers, they can reach the high pantry. What are some other things and things that are available to parents out there to help, keep things safe and locked up?
I think that's when you start having conversations with members of your household, especially kids that are getting a bit older and their comprehension level is getting stronger. So having conversations around the importance of keeping medications safe and stored and only using meds that have been prescribed to you by a doctor, received at a pharmacy, not from a friend or your aunt or uncle or someone online, but from somebody, a licensed physician. So having those conversations, but also other tools I would say is maybe designating a certain time and place where you rally around the kitchen or wherever else and observe your family member taking that medication. So let's say if it's every 4 to 6 hours, okay, at noon and at 6 p.m. we're going to get in the kitchen and I'm going to watch you, or I'll give you your medication. That way you're really preventing accidental misuse or overlooking. Your child may think that they can take it on their own and they took it 3 times a day versus twice a day. So that may be another effective method.
Got it. Dr. DiBlasi, are there any things that you've found in your work with families and adolescents that might be helpful?
A few things that I found helpful for people with families and kids is that make sure that there's a lockable storage container. They make storage devices that are sold specifically for medication to be stored that either has a key or a combination lock that kids are not able to get into as well, or having a home safe as well. Same thing with the key or combination lock, and not using something common and simple as a 1, 2, 3, 4 code, but something that kids would not be able to guess, as well as keeping the key on a parent's key ring or out of the reach of the kids as well.
I know having the conversation about prescription medication is also really important, and talking to your kids and letting them know, where to get their medication, that there's a trusted source, that, they're not just getting it from a friend or whoever. What are some of the things that parents can make sure to discuss in those conversations when they're talking to their kids about safety and prescriptions and making sure that they don't, misuse or abuse either their own or other people's prescriptions?
Well, we want to talk to our kids and we want to educate them. We want to talk to them about facts, not fear. So if a parent needs to practice and prep what they're going to say before they have that conversation with children, we recommend that. Definitely, because we want them to really talk to them about clear communication as to what they're trying to say. We want to make sure that the message is communicated that, yes, people need medication, but they shouldn't be taking other people's medication. It's not candy. They shouldn't be using someone else's medication. And that, of course, there's always an appropriate time and location for them to have that conversation. Not as they're running out the door, not as they're running in the door, or, not where they don't have enough time to handle the kids' questions. So that's why we say make sure that there's an appropriate time and location where parents can be calm, relaxed. They don't feel rushed to finish the conversation. They don't feel stressed because the kids will pick up on that as well. We also want to make sure that parents use age appropriate language, that they're using conversations that the kids can understand and questions that they can comfortably answer that might be on the kids' level as well. So using simple language is always the best. We also want parents to be honest with the kids. We don't want them to really talk around the question. We want them to explain what is the medication used for? Why are they taking it? What are the dangers associated with taking with someone else's medications? And we also want to talk about the fact that a doctor is prescribing it, so they don't want to take a friend's medication or someone else's medication because that medication has been prescribed for that person specifically, and that it isn't addictive substances. So there are side effects that can go with it. And they need to know that there are misconceptions out there that their friends may introduce to them, but that to get them back to their parents and ask the truthful information and to get a correct answer from them.
As a parent, I would say do your homework. There are resources out there, websites. DEA, we have a couple of websites, age appropriate, as Dr. Heather mentioned, to help guide those conversations with your child at any age. So it's operationprevention.com and justthinktwice.org. There's resources out there to give you tools, sample conversations that you can use and guides just to go into those conversations informed with data. Kids are curious. They're going to ask questions. That's why, again, stressing patience and calm and ensuring a distraction-free environment. So again, like Dr. Heather mentioned, allocating time where no one's on their phones, tablets, the parent or the child, neither of you are distracted. You're not multitasking, cooking dinner, running errands, or whatever it may be. Setting aside that time where both of you are focused, having that conversation, and being patient. Kids are curious. They're going to have questions, and being able to answer their questions directly but calmly and appropriately.
Those are super helpful tips and resources. And as always, the resources will be located in the show notes so people can just go and access those really quickly. I really appreciated both of your points. Another thing I think about for this conversation is this is an opportunity to teach our kids that self-medicating is not a helpful thing or not a healthy thing. And so we might think, you can just go grab some Tylenol out of the, the pantry or the medicine cabinet. You can go grab some Benadryl. When we're talking about prescription medications, we're talking about those medications too, because we want kids to know that those things should still be guided by a parent, by a doctor. And, how does that translate then down the line to things like cannabis or, opioids or other things like that, where people aren't just taking it into their own hands and that they're getting a doctor's kind of feedback.
Right. And over-the-counter medication can also be, abused and just as dangerous, when abused, NyQuil, Dayquil, Benadryl, caffeine pills, all of these things are easy to get at any CVS or anything like that. But they can be severely abused because they are so easy to get and because they are easy for kids and adolescents and young people to just come across.
I think that's a really helpful and great point. Just a couple of years ago, we heard about how, there was a rash of young people overdosing and misusing melatonin, which is a vitamin commonly used for sleep. And again, is safe, but not when we're not taking it as prescribed and as kind of indicated, in gummy form and all these different things. People can mistake them for candy, or, you're just thinking, oh, well, I just need to sleep. And so I'll take a couple, but a couple can be too much when you're not getting the right dosing. Another thing we want to talk about with folks is, inventorying these different medications and being able to keep track of what's in your home. So often, right, we're prescribed thing after thing, and after a while, you might lose track of it. Luis, do you have any advice for folks about how best to work on that inventorying piece?
So we spoke about designating certain times where the parent or the caregiver, the guardian, can give that child or the young person in the house that medication. But another way is to keep inventory of the medication. Whether it's an over-the-counter melatonin or whether it's a prescribed opioid, you should know how many pills or tablets came before the seal was broken. And doing a regular inventory, whether it's pouring out the bottle of medication on the kitchen counter or on a counter, keeping a regular inventory and tracking that should help you as a parent, as an adult, as a guardian, monitor your child's consumption of prescription medication or any other medication that should be supervised.
Yeah. And I mean, I know, as a young person who, did a lot of stupid things as a kid, I remember people going into other people's houses and going into their medicine cabinet and seeing what was available. So even if, maybe it's not your kids that you're concerned about, or it's not, something that you're dealing with in your house, oftentimes other people are coming into your house, going into your medicine cabinet, and if you aren't securing those medications properly, they are getting access to them.
Another reason why inventorying can be really helpful, I think, is also to make sure that your kids are taking medications as prescribed, or that they are prescribed. Like, I have a lot of young people that I work with who say, I don't want to take my, antidepressant anymore. I don't want to take my ADHD medication, which is okay. Like, let's invite a conversation about that, but they might just stop taking it altogether. And so if we're inventorying it and double checking and dispensing it, then as parents, we have more empowerment and more knowledge in order to address those types of situations. And we know, again, when kids' mental health is treated, they're much less likely to misuse substances. And so it's a really important part of the discussion.
You're watching Awkward Conversations Season 4.
Saving lives means staying informed. Knowing the dangers of using fake prescription pills can help those you care about and keep our community safe. As a parent, educator, neighbor, or friend, we all play a role in building safe and healthy futures for ourselves and our loved ones. Do your part to take the first step today. Visit GetSmartAboutDrugs.com to access education, prevention, and treatment resources. Fake prescription pills laced with fentanyl are deadly. Be their protector. Be informed. Visit GetSmartAboutDrugs.com.
Welcome back to Awkward Conversations Season 4.
Jodie, you mentioned other people who come into our homes. Besides having our own medication that we have to be mindful of, we have to be careful also of other people's medications. Grandparents, visitors, our kids' friends. Another important thing too is if you're selling your home is not to leave medication unsecured. So we have to keep track of not only our medication, but other people's medication. We could be very mindful and very careful of the medications that we have around, but other people may just throw them in a pocketbook, a coat pocket. They may just throw them on your kitchen counter or table. And we have to be very careful of that too. So we need to be very careful of keeping track of medications that come into our home as well.
Now, as safe as we can be with medications and keeping them locked up and things like that, there are times where there are either accidental ingestion or accidental overuse or misuse. What, as a parent, and then that's like your worst nightmare is I don't know what happened or how to help. So what are the ways that we can, if that is a situation that's occurred, show up, be prepared, and be ready to help our kids, get through a situation that could be really dangerous?
The first thing we want to do as parents is we want to stay calm. We don't want our kids to panic as well, even though it's a very scary and very dangerous situation. So we want to make sure that as parents, we are going to project calmness into the situation. We then want to make sure that we can gather any kind of details, if possible, about what happened. What did the child consume? How did they consume it? When did it happen? Do they have the bottle? What did they take? Because these are information that when we call 911 or poison control, which would be the very next step that we need to do, is these are questions that they're going to ask of us. So if we can have any kind of clarifying detail, that would be great to pass on to them. We want to make sure, too, that we don't induce any kind of vomiting at all, unless we are instructed to do so by poison control or by 911. And then we need to monitor the situation. Make sure that the child is safe, or safe as can be. Make sure that they're having a seizure, that we clear the space around them. If they do pass out, we need to convey that right to 911 or poison control as well. We want to make sure that when EMS comes to the house, or if it doesn't need to come to the house, depending on what poison control tells us, that we follow those directions to a T. We don't leave something out. If EMS comes, we make sure that we follow their advice. If a child needs to be transported to the hospital, we don't go against that medical advice because they may have more medical information than we do at the time, so we need to follow them. And then after the incident is over, we need to make sure that we prevent future incidents so this doesn't happen again. So do we need to resecure the medication in the home? We also want to make sure that we have a follow-up conversation with that child to make sure, why did they do it? What were they hoping to achieve by taking that medication? Is there something deeper going on with that child? Are they having some kind of issue? Were they trying to escape? Is there a type of substance use issue going on with that child? And then at that point, do we need to follow up to make sure that they need ongoing help, that we get it for them? And of course, we want to make sure that we know our child loves them. We want to make sure that they know they're safe in their home, and that we're going to do everything we can to support them.
One thing I would add to that wonderful list of things to help families is just a reminder to folks that naloxone, which is also called Narcan, is a medication that folks can use in the event of an opioid overdose. And it's now, as of recently, been approved by the FDA for us to get over the counter. And so any family can go to their pharmacy and access Narcan now. And, you know, in the program I work in, we often advise people to have that on hand, because it could be a loved one, it could be a family member, it could be someone in the grocery store. I met with a young person recently who said, this happened at my work. And so just like we have defibrillators and other forms of CPR available and people are trained in using, having naloxone, Narcan at your home can also help you in the unfortunate incident of an opioid overdose, which could be a result of taking prescription medications or medications that have been laced or tainted with fentanyl or other opioids.
Yeah, I have Narcan in my house. There's nobody that uses opioids in my house, but I have it in my house and I have some in my car. You know, I live in a big city and there's a lot of things that happen, and I think it's really important that, you know, people know that that is available, know that it's out there. So yeah, I highly recommend that. It can absolutely reverse some really, really scary opioid overdoses. So, you know, and of course, amongst this discussion is the constant reminder that the safest home has the least amount of medications and opportunities in it to abuse those medications. So, you know, obviously people have health issues, things like that. But if you have been prescribed medication that has since expired, or you were prescribed opioids for, you know, a surgery and it's been 6 months, you know, let those medications go, get them out of your house, figure out how to properly dispose of them. And I know the DEA actually has a drug take-back day, which I would love to hear more about, because the proper disposing of medications is also really important. It's not, we don't just throw in the trash. There's different ways to do it. And the DEA has their drug take-back day. So I'd love to hear more about that.
So for more than a decade, the DEA has hosted the National Prescription Drug Take-Back Day twice a year, and that's a chance for Americans to safely dispose of their unneeded, unwanted, or expired medication, which we know can often lead to substance use disorder, misuse, or addiction. We have DEA agents, task force officers, diversion investigators, basically everyone across the DEA working really hard to combat this opioid epidemic, and one gateway to that has been misuse of prescription medication. So it's a chance, again, for Americans to safely dispose of their unneeded, unwanted prescription medication. And typically in the past, we've hosted Take Back Day twice a year, once in April, once in October, toward the latter half of October.
How does safely disposing of prescription drugs contribute to preventing substance misuse, as well as helping out the environment?
So we know our nation is facing an opioid epidemic. We have over 109,000 people dying of drug overdoses. That includes prescription drug misuse or overdose of a prescription drug. So being able to safely dispose of unneeded, unwanted opioid medication can help reduce the number of injuries, harms, and even deaths. So as we've already mentioned during this episode, opioid misuse remains at pandemic levels here in the United States. SAMHSA data shows that majority of people who have misused a prescription medication obtained it from a family member or friend. That's why we're stressing the importance of safely disposing of unneeded, unwanted medications that are in your household.
Are there any common misconceptions about Drug Take-Back Day or about proper medication disposal that you could address for us?
I think some of the misperceptions or some of the confusion around Take-Back Day is what we do and what we don't accept. We take pills, tablets, patches, we'll take liquids in sealed closed containers. We do not accept syringes, and we do not take illicit drugs. So please do not show up to a DEA Take-Back Day event with illicit narcotics. Also, other misperceptions around Take-Back Day questions are, why can't I just throw them away in the trash? Or why can't I pour them down the bathroom sink or flush them down the toilet? The reason we advise to not flush medication down the toilet or just pour it down the drain is because that can actually contaminate the water supply. So again, Take Back Day is designed to even be environmentally friendly way of disposing of unneeded, unwanted, or expired medication.
What are some alternatives to safely disposing of medication in case someone misses Drug Take Back Day? How can they do it safely on their own?
Sure. So some alternatives, if you happen to miss the Take Back Day events that we host twice a year, there's thousands of pharmacies, businesses, police departments, public health departments around the country. They host their own year-round take-back initiatives, drop-off initiatives. So you can look up your local police department, public health department, check with your local pharmacy or even your hospital. You can also visit the DEA Takeback website, dea.gov/takeback. They have a takeback locator where you can punch in your address or your zip code to find your closest drop-off locator for the Take Back Day event. I know here in Chicago, within a 50-mile radius, there's over 80 take-back locations where you can safely dispose of your unneeded, unwanted medications.
I just want to thank you so much for joining us today. Luis Agostini from the DEA and Dr. Heather DiBlasi, you have added so much to this conversation and really reminded us how to keep our kids and our homes safe from the abuse of prescription medications. And Amy McCarthy, thank you as always for joining us in this conversation.
Great. Thank you so much, Jodie, Amy, Dr. Heather. It was a pleasure. Thank you.
And Dr. DiBlasi, we would love to know more about how people can have you come and speak to them to help with, all of these awkward conversations.
Reach out to me directly at email at heather@drheathertalks.com. So heather@drheathertalks.com. And I'd be more than happy to come out and educate students on the truth of these conversations and more. Thank you.
That's wonderful. That'll be in our show notes, of course.
Yes.
Well, that's all for now. Tune in next week for more of Awkward Conversations Season 4. Kids, right? Their quirks can make us laugh, but they also have this incredible ability to inspire and change the world. Every day, we're reminded of their passion, creativity, and resilience. And in today's episode, we'll meet one such amazing young woman who clearly has found both shoes and is well on her way to making a real difference.
My involvement began in my hometown when a close friend of mine from 5th grade was dealing drugs and getting involved with some really bad substances, and I was able to help him get into the program and find the resources that he needed to get out of that.
We'll also be joined by several dedicated individuals working tirelessly to provide our kids with the tools, inspiration, and opportunities they need to engage in meaningful initiatives, build resilience, and help their peers stay substance-free.
Our focus is making Kentucky the best place in America to be a kid. And we do that by lifting up data and research that helps connect decision makers and policymakers to what's best for kids and families. And we also create opportunities through several initiatives to lift up the voices of young people with their lived experience or things that interest them to take to policymakers and decision makers.
I'm Jodie Sweetin, and welcome to Awkward Conversations, where we give parents practical advice on raising happy, healthy, substance-free kids, empowered to make smart choices, and maybe even change the world.
Make sure to check out GetSmartAboutDrugs.com. Parents, caregivers, you can find so many resources of great information there about how to talk to your kids and make these conversations a little less awkward. A huge thank you to the Elks DAP, which is the largest all-volunteer nationwide drug awareness program, and also a huge thanks to the DEA for their outreach program and for making this possible.
The views, information, or opinions expressed during the Awkward Conversation series are solely those of the individuals, speakers, commentators, experts, and/or hosts involved, and do not necessarily reflect nor represent those of the production, associates, or broadcaster, or any of its employees. Production is not responsible and does not verify for accuracy any of the information contained in the series available for viewing. The primary purpose of this series is to educate and inform. This series does not constitute medical or other professional advice or services. This series is available for private, non-commercial use only. The production, broadcaster, or its channel cannot be held accountable for all or any views expressed during this program.